When it comes to women's health, there's one thing we're incredibly bad at, and that's talking about it.
Most people are saving for a house or saving for like luxury holidays, and then where they're saving for the next surgery. I would say I've definitely spent over £15,000.
You can feel so isolated and so alone, like there's no answers.
I'm Mia Williams, and I'm going to be meeting women struggling with endometriosis, PCOS and chronic UTIs.
We really are lacking a lot of understanding about chronic UTI.
PCOS is the most common condition that impacts women of a reproductive age, and we still don't know what causes it.
We're all aware that healthcare can fail patients, but research has found a gender health gap in the UK where many women receive poorer healthcare than men. One condition that exclusively affects women is endometriosis, and it's thought that over 1 in 10 women in the UK suffer with it. Endometriosis is where cells similar to those in the lining of the womb grow in other parts of the body, and it causes extreme pain. It's often found in areas around the womb, such as the ovaries, fallopian tubes, and lining of the pelvis, but can also be found in organs such as the bladder and the bowel. It's a common misconception that those with the condition only suffer with symptoms during their menstrual cycle, but for many it causes problems every single day.
So my mum had really painful periods, so I grew up seeing that and thinking that that's normal, and I'd like dread it for when I start my period. And I started my period really early, I was around 10, and I had like excruciating pain, and I thought, well, this is normal, like, this is what it must be like because my mum went through it. And it wasn't until like the age of 16, 17 that I thought like I can't carry on like this anymore. And then I did some research myself and found out about endometriosis. And from reading the symptoms, I thought, that's what I've got. Like, I've got endometriosis. So I went to the doctors with this information and I said, I think I've got endometriosis. And they just said, no, you haven't got it. And then one day I was just in so much pain. I went to A&E and I saw a gynecologist. And it was like 3 o'clock in the morning. I said to him, like, I can't do anything, I'm in so much pain. And he said, you'd be crying if you were in the pain that you're describing. And I said, I have been crying. Like, I've run out of tears to cry anymore. I've been here since like 11 o'clock in the day. It's awful.
Hold Wellbeing is a retreat for women suffering with endometriosis, with the aim to change their perspectives and challenge existing beliefs about the condition. While there is currently no definitive cure for endo, being in a space with women going through similar experiences can help people feel less alone. Many of the women are at very different stages of their journeys with the condition, and it's a helpful space to share tips about what has helped them along the way.
I didn't even know what endometriosis was until I was diagnosed with it, and they just told me in hospital, you've got endometriosis, you've got ovarian cysts, there is no cure, we'll send you to a gynecologist. And that's how it was left for months. At the time, I was in shock, and I remember thinking when they said there was no cure, I just felt lost because no one really explained it to me what endometriosis was. And it was only when I went away and me and my mum really researched into it that I realised how much my life was about to change. It's been really difficult. It's affected my work life, my relationships. As a person, I've changed. My body's changed, the way it looks, the way it works. I can no longer be as active as I once was. It's been pretty life-changing, I'd say, for me.
Studies show that 62% of women between the age of 16 and 24 don't know what endometriosis is.
I was abroad and I became very, very unwell and ended up in hospital for 2 days with some kind of infection, and they didn't really know what was going on, but I was having really severe, what I know now is endo symptoms, so bleeding, severe pains, absolutely no appetite, felt really, really sick, zero energy, couldn't even get out of bed. When I came back then, it went on for another 2 years trying to get to the bottom of what was happening, and a few A&E visits and being told, oh, it's nothing, it's just need to deal with it. And then it was 4 years later that I had my first laparoscopy. It was like, oh my God, they found it. And at first I felt so happy and relieved that it kind of there was an explanation for everything I was going through, and it wasn't in my head, it wasn't, you know, low pain thresholds, like things that I'd been told for years. But then obviously it does hit you that this is a lifelong condition.
Yeah.
It's going to have so many effects on, you know, potentially fertility, but more so the process of getting pregnant possibly in the future.
While women with endometriosis can get pregnant, it may be more challenging. It can affect fertility due to inflammation, scarring, and other factors impacting the reproductive organs.
Being in a long-term relationship with endometriosis can be really difficult. I feel like there's been a lot of times where I felt like a burden. Obviously endometriosis affects like sex, that's very painful. And I think that's a really taboo topic and people don't like talking about it. But obviously that's a part of a relationship. And for me that's been really difficult. And I think a lot of women, that's where a lot of the guilt comes from with women.
Surgery for endometriosis typically involves a laparoscopy procedure, where the surgeon can remove or destroy endometriosis tissue using tools.
I've had 3 laparoscopies, so they're the ones, the keyhole surgery to remove the endo. So I've had 3 of those since 2018. The last 2 surgeries out of the 3 I've had to pay to go private for and get into debt for because it couldn't work. I was on 26 tablets a day. I was on a bottle of morphine a week. I'd say I've definitely spent over £15,000 since 2018, and a lot of that has been taking out loans and stuff. I'm not, you know, I don't have loads of money or anything like that, but I am desperate to just look after myself and have a full life and make memories.
But my family were just so upset seeing me the way I was, so they actually helped me pay to go private with a specialist, because I could never have afforded that. And it's not something that like my family can afford, but they did it.
The cost to have endometriosis surgery privately in the UK can range anywhere between £4,000 and £14,000, depending on the severity, complexity and location of the surgery.
I just remember like waking up from surgery and it was straight away, like they just woke me up and he was standing over me and he said like, Katie, you've got endometriosis. And I just can't explain that feeling. Like it's something people don't understand. Like you think, why would you be happy about that? But it was just such a relief, like years and years and years of being gaslighted. Afterwards, he came and told me that it was on my bowel, on my bladder, around my ovaries. Even though I felt like this sense of relief, it was also like, you have a condition with no cure.
You have to sign disclaimers as well that when they go in, they may need to perform a hysterectomy if things are so severe. So you have to sign all of these things away before you even get into the operating theatre.
And I've also been warned multiple times that I could be left with a stoma because of the severity of my endometriosis. So that's quite a scary thing to sign that saying I'm happy to have that.
Endometriosis isn't the only condition without a cure affecting millions of women across the UK. It's one of many. It's estimated that over 1.7 million women in the UK are battling with chronic UTIs, a condition that wasn't even recognised on the NHS until 2022. A chronic UTI is very different to an acute UTI, which is an infection we are all well educated about and have probably all experienced at some point. It's a UTI that doesn't go away and recurs over and over again, and it can be debilitating.
So my name's Miss Rhiannon Bray. I'm a consultant in obstetrics and gynecology, but a subspecialist in urogynecology. We would label a UTI as a chronic UTI when it's long-standing. Another term that we'll sometimes use is an embedded UTI, so we'll say a chronic or an embedded UTI, as opposed to an acute urine infection, which usually presents quite quickly, but also clears up quite quickly. An acute urine infection can turn into a chronic infection, so we'll start off with an acute phase, and then the symptoms may stay the same or they may dampen down, and then they continue for a long period of time. I think it will often surprise lots of women that chronic UTIs can actually go on for months or years and can present with different symptoms than an acute UTI. The symptoms that a patient with a chronic UTI might experience is urgency to go to the toilet, so feeling like they need to go to the toilet more often. They might be getting up at night to go to the toilet, which is a new thing, or they might be rushing to the toilet to pass urine. It can often start with a phase where symptoms are worse and then it gradually continues. Different women will experience pain to different degrees, also depending on what else is going on in their life. So there can be phases where women will describe very severe pain, but other times when it's maybe described as a 3 or 4 out of 10. But if that's constant for weeks and months, that's massively debilitating.
A urine test may not always pick up the chronic infection, which can be infuriating for patients who know that they are suffering. This is due to many reasons, one being that bacteria can become embedded in the bladder wall.
When it comes to the diagnosis of chronic or embedded UTI, it is extremely difficult. We really are lacking a lot of understanding about chronic UTI. So we don't really understand why some women suffer and other women don't. We think that we're all exposed to the same main bacterias, and there tends to be just a few bacterias that we understand to cause urine infection, but we're all exposed to them. But why do some women continue to suffer and others don't? We wonder if maybe one of the bacterias embeds itself in the lining of the bladder and doesn't respond to short courses of antibiotics. We know that the bacteria can be quite clever, so they hide in these little pods called biopods, and they hide from antibiotics. So short or even 7-day courses of antibiotics may not necessarily work, which is why we'll often end up using longer courses of antibiotics.
As there is currently little recognition and knowledge about the condition, many women have taken to social media to share their experiences.
A chronic UTI can have a massive impact on a patient's quality of life. It can affect every aspect of their day-to-day life. So we sometimes say toilet mapping if they're looking to see where the toilet is all of the time. It's a chronic condition, debilitating condition, so it can actually cause depression, have an effect on women's mental health. We worry that can also be quite isolating. If women are worried about leaking or worried about finding a toilet, then they might actually be less inclined to go out, less inclined to socialise. There can be certain foods and drinks that can make symptoms worse as well, or women might notice that they're a precipitant for their urine infection, and that can also affect their quality of life. I'm really passionate about helping women and women's health and preventative medicine, so trying to stop things before they get worse. So being able to help a woman with UTIs who's been suffering for a long time and hasn't felt heard, or potentially maybe it's not been recognised that it's a chronic infection that's caused the problem, is extremely rewarding to be able to help them and feel better and, you know, advocate for women.
Polycystic ovary syndrome, commonly known as PCOS, happens to be the most common reproductive condition that impacts women of a reproductive age. It's thought that 1 in every 10 women in the UK suffer, but we do not know what causes it or cures it.
My name is Jodie Ralph. I'm a registered dietitian and I specialise in working with women with polycystic ovarian syndrome. So PCOS is an endocrine disorder. It's most common in women of reproductive age. It causes insulin resistance, weight gain, difficulty losing weight. From a reproductive perspective, it causes problems with ovulation, so irregular ovulation, disturbances in the menstrual cycle, so absent periods or just irregular cycles. It also, from a hormonal perspective, impacts testosterone levels, which is where we see kind of acne around the face, chest, back. We see something called hirsutism, which is male pattern hair growth. And as well as that, we see male pattern baldness. Those are probably the most common symptoms. Before I was diagnosed with PCOS, I'd never heard of it before. I think I started showing signs quite soon after going through puberty, and I was just told to go on the pill because I had my period non-stop, and that's where it ended. In my early 20s, I then decided to come off the pill. I didn't want to be on it anymore, and my periods just never showed. So I was at the time in South Africa and lucky enough to be able to go to a private gynae, and I was diagnosed quite quickly, but given no information. It was just, you'll just have to take the pill, and that was it. And yeah, because it's a chronic condition, it's never truly going to go away.
As with many health conditions, adopting a healthier lifestyle can improve the symptoms of PCOS. But there are many misconceptions about what food people with the condition can and can't eat. And with so much misinformation, it can be hard to know where to go for advice.
Weight loss is often recommended for PCOS. There is no long-term research to show that weight loss helps manage PCOS symptoms. I think there's a lack of research because it's women's health, and we know that that's really under-researched. It's definitely getting better, but PCOS is the most common reproductive condition or condition that impacts women of a reproductive age, and we still don't know what causes it. If you are struggling to manage your symptoms, the first thing I would recommend is making sure that you're eating enough. In terms of what contradictory information is probably most common, I think eliminating certain food groups, so specifically dairy, gluten, you hear that all the time. Carbohydrates, there's lots of confusion around carbohydrates. Instead of restricting, instead of removing food groups, think of every meal as an opportunity to nourish your body. What anti-inflammatory foods can you add? Is there fruits and vegetables in every meal? So finding opportunities to nourish your body instead of restricting and taking away.
The gender health gap in the UK is undeniable. It's no coincidence that we do not know the cause of conditions that exclusively or mostly affect women, nor do we have a cure for them.
I think living with a condition with no cure, it's horrific. Like, if you really think about it, and like trying to work that out in your brain, I think you can't comprehend it. And when there's no support and these massive waiting lists to try and manage the symptoms, you can feel so isolated and so alone. There's no answers.
Before 2024, it wasn't a requirement for new doctors to learn specifically about women's health. Before this, it was deemed a special interest module.
With regards to the gender health gap, I think the first starting point is we're really lacking research in women's health. When research studies are designed, often women of a reproductive age, sometimes we're excluded from those trials, so there's a massive lack of research when it comes to women's health. I think the tide is changing now, so that's fantastic, and we will move forward. And then the bigger problem of the gender health gap across so many different specialities is a massive problem.
While we know that there is now more research into women's health than ever before, still only 2% of medical research funding is allocated to areas like pregnancy, childbirth, and female reproductive health.
I think there's a lack of research because it's women's health, and we know that that's really under-researched. It's definitely getting better, but there's a huge gap in our knowledge.
With so many question marks and uncertainty, it's so important that women come together to share their experiences.
Although we're all suffering with the same condition, it can differ in people's cases. Just goes to show how different our journeys can be, even with the same condition.
I think find your people. Find that community, because after I was diagnosed with endometriosis, even though I joined Facebook pages, I still felt alone.
I remember thinking when they said there was no cure, I just felt lost because no one really explained it to me.
84% of women report feeling ignored by healthcare professionals. And advocating for themselves has never been more important.
Don't give up. I know it's really difficult getting told that it's just period pain, you've just got to get on with it, but you don't. You have to fight for yourself.
Despite living with a chronic condition, there is a way that those suffering have found ways to live a fulfilling life, by coming together and advocating for change. In years to come, the hope is that no woman will be struggling in silence.